Nursing home abuse occurs when staff of nursing care facilities cause intentional or unintentional harm to their patients. The effects of nursing home abuse can include trauma responses, depression, and even extremes such as death. That makes it vital for anyone with a loved one in a nursing home to familiarize yourself with the different forms of abuse. With that knowledge, you'll be in a better position to identify abuse and help your elderly family member. According to the National Council on Aging, nursing home abuse can take many forms: physical abuse, neglect, emotional abuse, sexual abuse, abandonment, and financial exploitation. Physical abuse refers to any mistreatment that leads to physical pain, injury, or impairment. However, some types of physical abuse, like malnutrition and dehydration, can be subtle and may go unnoticed. Common types of physical abuse include punching, burning the skin, ignoring medical conditions, kicking, tripping, shoving, threatening, and even ignoring calls for help. Sadly, physical elder abuse cases continue to increase. According to the National Center for Victims of Crime, the NCVC, 27.4% of reported complaints are related to physical abuse. The CDC has noted that the abuse rate among 60-year-old women increased by 35% between 2002 and 2016. During that same time frame, the abuse rate among men over 60 increased by 75%. Also, according to the CDC, neglect is defined as the refusal or failure of a caregiver to fulfill his or her obligations or duties to an older person. The NCVC reports that 15.3% of all elder abuse complaints are related to neglect, including medical and general neglect. Medical neglect refers to the failure of nursing home staff to provide the elderly patient with the medical treatment, care, or devices they need. General neglect is a refusal to provide a nursing care patient with basic necessities like food, water, shelter, medication, and personal safety measures. It can also include failure to provide proper sanitation, report infections or illnesses, keep the facility at a comfortable temperature, change a senior's clothing regularly, or change their clothes if they soil themselves, properly bathe them, or protect vulnerable residents from accidental isolation. During emotional or psychological abuse, a resident suffers emotional pain or stress from deliberate acts of malicious and non-physical exploitation. These acts can inflict fear, mental pain, distress, or anguish. Emotional abuse doesn't actually leave visible scars, which makes it very challenging to recognize. That also makes it one of the most common forms of mistreatment in nursing homes and includes isolation from other residents or family, taking away walkers, canes, hearing aids, and glasses, name-calling, threats, and intimidation, taunting of patients and humiliation, limiting resident freedoms such as access to telephones and transportation, giving a resident the silent treatment. The NCVC found that 19.4% of the reported cases involved emotional abuse. Additionally, 33% of care facility staff members admitted to having emotionally abused residents. Sexual abuse refers to any non-consensual sexual activity. Sexual abuse can occur at the hands of staff, other residents, or even visitors. It includes forced nudity, unwanted touching, sexually explicit photography, rape, and sodomy. The effects of sexual abuse are far-reaching and can affect victims physically, emotionally, and psychologically. Sexual abuse can also lead to sexually transmitted infections that can be especially dangerous for elderly populations. Abandonment occurs when a person who has assumed responsibility for a resident's care and well-being deserts the resident. This includes failure to regularly check on patients, ignoring their calls, failure to aid them in necessary tasks, such as eating and moving, not supplying proper nutrition, and not administering medication. Financial abuse in nursing homes is the improper, unauthorized, or illegal use of an elder's property, belongings, assets, money, or benefits for financial gain. Financial abuse occurs when individuals take advantage of a patient's inability to comprehend complex financial transactions. More specifically, this type of abuse includes betrayals of trust, such as forging a resident's signature, stealing or misusing a resident's money or possessions, manipulating a resident into signing any document, misuse of conservatorship, guardianship, or power of attorney, identity theft, using an elder's cash or credit cards, and using undue influence to change a person's last will and testament. According to the National Adult Protective Services Association, 5% of older adults suffer from financial abuse. The NCVC reported that 7.9% of complaints were related to financial exploitation. A nursing home is responsible for the treatment and well-being of its patients within the premises, regardless of who perpetrates the abuse. A resident or their family can hold a nursing home accountable for any of the abuses above through legal recourse. You can report suspected nursing home abuse to the police or local adult protective services. There is no penalty for reporting suspected abuse, and you may help the person get the help they need. For more information about elderly abuse, contact us today. If you believe a family member was injured due to elder abuse, maltreatment, or neglect in a nursing home, contact us for a free case evaluation. nursinghomeabuse.org, exposing nursing home abuse and helping seniors get justice.